Welcome everyone. For those of you that don't know me, I'm Penny Williams from Program 5 of the Human Robot Workforce in the Australian Cobotics Centre. And I'd like to welcome you all here today for this seminar. I'd like to begin though by acknowledging the traditional owners, the Turrbal and Yugara, as the First Nations owners of the lands on which QUT now stands, and the lands from which many of us are joining you today in this kind of unusual time, let's say, if you're in Brisbane, certainly anyway. And I'd like to also acknowledge the traditional owners of the lands from which you're joining us, wherever you are today. Pay my respects to their elders, laws, customs, and creation spirits, and acknowledge that, these have always been opportunities to share ideas, stories, and knowledge. And that's what we're going to be doing today. We've invited Karen Hoekenstra, and I probably pronounced it wrong, Karen. I've been practicing, but I still think I haven't quite got it. Karen joins us from Karolinska Institute in Sweden. She is an associate professor of work science with a research interest predominantly in how digital technologies affect the work and the health and safety and well-being of employees. So Karen is working on a project on algorithmic management and occupational health and safety, which I am also somewhat involved in. And she's here in Australia extending that project and looking at how some of that might apply to mining. But today I believe she's going to share with us some of the findings from not just the work she's doing now, but a project prior to this, that you all might find interesting in relation to how algorithms are, changing workplaces. So, Karen, I'll hand over to you.
Thank you very much. I'm so happy to be here and to be able to speak to you. I would have loved to be there in real life for some of you, but unfortunately that couldn't take place. I'm extremely interested in what you are doing, so I hope when this cyclone thing is over, I can come and visit and learn more about cobotics and robotics and all that. But today I'm going to talk about me and what I do. Going to share a presentation. Just a question of order. Now we start at 10:30. How much time do I have?
Until 11.
Okay. Right. So this is me. I work at the Unit of Occupational Medicine at a medical university, the biggest and most prestigious in Sweden. But I'm not from the medical sciences myself. I'm a social scientist. No, it doesn't work. Okay, I'm going to try again. All right. So these are my talking points. I'm going to speak a little bit about this large international interdisciplinary research team that I'm leading, the research goals and initial findings of this program, and then a little bit about how to engage stakeholders and how we work to achieve societal impact. The program, of which Penny is also a member, is called ALGOS. It stands for Algorithmic Management at Work, Challenges, Opportunities, and Strategies for Occupational Safety and Health and Well-being. And we started in July 2023, and we're going to go on for 6 years until mid-2029. I'm going to start with how it came about. There was a research call from a Swedish Research Council in 2022 called Challenges in Working Life 2023. And what they offered were so-called program support grants, which is not the normal smaller projects, but it was like intended to build up new or strengthen and develop existing research environments, which meant that the application was very large. I had to, I don't know how many pages I wrote, but it was a big job. But I was persuaded by a senior member of staff who said to me, you know, Karin, this is a chance that doesn't come often, because they had identified 4 focus areas, of which the first one was the significance of digital technology to an efficient and flexible working life linked to people's conditions and needs. And that was exactly what I was doing, because I had just landed a 3-year project on algorithmic management in transport and warehousing. So she said to me, it's going to be a lot of work, but I don't think you'll regret it. And I don't. I did sometimes along the way when I was writing the grant, but now I'm very happy, of course. So in the instructions for this call, it actually said that we had to include expertise from multiple research disciplines, senior and junior researchers, and it also said if you have international connections, that's also a plus. And so I did, and which was not an issue for me, because I always like to work internationally. So I mean, this was not a problem for me. But that's also why it sort of had to be international and multidisciplinary. All right, so this is the team. On the left side, that's people on my side. That's me and my research assistant, 2 PhD students and a postdoc who do most of the work, like on admin and also research. And then some very, very good colleagues that also assist us, Theo, Nuria, Maria, and Nini. And then on the right side, we have the outsiders, which are mainly international, but we also have a Swedish scholar. So I put the Australians up top so that you'll see how important they are for this program. Penny, of course, but also Michael Quinlan, who is based at NSWU. We have labor lawyers. We have Virginia from Canada, who has a background in nursing and occupational medicine, Swedish labor lawyer. We have the Finnish Institute of Occupational Health, psychology. We have human-computer interaction from the US. And then we have a group from the Netherlands who are more into technology and safety management. And then we have also quite a few people who are with us, like on the fringe. I'll come more to that, but this is like the core group, I'd say. When it comes to managing this program, I divided it into 3 work packages, and each of these work package has their own or 2 work package leaders. And the reason I'm delegating the management responsibilities is partly because they're simply better than I am on the specific topics in those work packages, but also to relieve my workload and to enhance like a sense of ownership, so that they feel that this is, you know, this is their work package. I'm the PI, but we do it together. There's also a bunch of admin, which I will not get into because it's very tedious. We had to make an international consortium agreement about the funding and intellectual property and other things, which was a nightmare, because I was there were lawyers in all these different universities who had anyway, I will not get into that. You can imagine. So research goals and initial findings. The overarching aim of ALGOS is to improve data and knowledge about algorithmic management in non-platform work, because when we applied for this funding, there was already a lot of research ongoing about platform algorithmic management in platform work. So we wanted to look at other like regular workplaces and how AM affects health and safety and well-being, and also develop risk-reducing tools and strategies. by these 3 activities, and each of these activities is then like the activities that we do in the separate work packages. So the first work package then, they do this, facilitating the development of a standard for measurement of algorithmic management at work and related risks for health, safety, and well-being. And we have developed a definition. I'm not going to read this. You're going to get this presentation afterwards, and we have also published this definition on our website. But I'm going to go through how we got there, because the original thought was, okay, if there is no official definition of algorithmic management, but if we had one that would facilitate creation of surveys, international standards, collaboration, etc., etc., etc. So we thought, okay, we'll give it a try. So we did a review of definitions first, and then we had 2 rounds of consultations with members and separate advisors, which I will come back to later, that are not really core parts of the program, but they're still with us. And then we came up from these consultations, we wrote down 3 draft definitions, which we sent out to all the participants, and we had a Delphi process where everyone could give their feedback on these 3 definitions. What was good, what was not good, what was difficult to understand, etc. And then eventually we came to a consensus on this final definition, which I just showed you. And we have written down the process of this. We are in the final stages of a manuscript that we'll submit to a journal. We have published it on the website, the definition of, and we have also just recently translated it into Swedish. So we have done a translation by a separate professional bureau, and then we have back translated it, etc. So soon we'll have also an official definition in Swedish, which is important to us, not you, I understand that. Right, so the second activity then, work package 2, there we look at increasing knowledge about the effects of algorithmic management on workers' health, safety, and well-being. So this is a bit more like the traditional kind of research that we do at my unit. And here we have 2 activities. The first one is a longitudinal sort of study of one of the largest logistics firms in Sweden. It's a mixed method study where they have thousands of employees all over the country. And last year we did more than 30 interviews and visits to 3 of their sites. Terminals. We talked to different types of workers and managers and safety representatives. And now soon we're going to send out a survey to approximately 6,000 workers in the company. And the idea is to repeat this cycle at least once, maybe twice, to sort of follow how it works. Because what they did in 2024 was to roll out a few, actually, algorithmic management systems. They have a staffing and scheduling system that they've rolled out, and also a route planning optimization system. In addition to that, we are preparing a very large national survey, which we'll send it out 2026, and we'll get the results in 2022. And that's like on the prevalence of algorithmic management and also the impact on safety and health. And so this one we don't do ourselves, but we are using the services of the Swedish Statistics Bureau We are in communication with them right now of how to do this and testing questions, etc. And there we're going to have, so we're sending it to a representative sample of the Swedish working population with an oversampling in 3 sectors where we know that algorithmic management is frequent. So these 3 sectors will for sure be warehousing and transport, maybe also call centers. We haven't really decided yet. And in the survey, we ask about we ask different questions to define the exposure, the type of exposure to algorithmic management, and how much exposure, and like digital monitoring, working hours, atypical working hours, psychosocial exposures, accidents, etc., etc., etc. And once we get the responses, the results from this, the Swedish Statistics Bureau is going to help us connect the data to different registers we have in Sweden. So we have, for instance, a register on occupation, so we can see what the occupation in which sector each of these individuals and anonymized individuals have had in the past. We get sociodemographic information. We can look at workplace and employment quality characteristics. We can look at the pharmaceutical register, mortality register, occupational injury register, sick leave cause periods, etc. So we are very lucky in Sweden that we have a lot of these registers that we can use. So the third aim then, or activity of work package 3, is to investigate the balance of interest related to the control of algorithms in different legal contexts regarding occupational safety and health. So this is where the labor lawyers and our industrial relations specialists come in mainly. But we also do another thing I'll show you here. We all, including Penny and me, we are right now almost at the end of going through a lot of abstracts in a scoping review, where we look at interventions, either planned or actually executed to reduce negative or strengthen positive aspects of algorithmic management. We also are developing a strain assessment tool. So, and this part is led by the Finnish Institute of Occupational Health, where my colleague Virpi is very competent in cognitive psychology. So she's leading this, and it's taking place in Finland and Sweden, and potentially also in the Netherlands. And then we also look at the tripartite response and regulation of algorithmic management with a focus then on health and safety. We plan to do a mapping exercise after the scoping review, and we are now looking through. We are actually also looking at. We're doing a legal analysis of the European Union AI Act. On safety and health. Right. So that's Algosh. Now I was asked to talk a bit about engaging stakeholders, and I mentioned this before, but we have these expert advisors. We have labor statisticians from the ILO and Statistics Canada on the team. We have a labor lawyer from the European Trade Union Institute on the team. Uma Rani is part of the team as well. She is like the leading investigator of algorithmic management at the ILO centrally. And we have 2 researchers from the European Commission. And then we also have, besides that, we have a Swedish stakeholder group where we have representatives from trade unions, employers' organizations, government agencies, and European agencies. Now, this you will not be able to read because it's in Swedish, but this is something that we just published a few days ago. And that was in this previous project, AMOSH, that ended in December last year. We had a policy workshop in November when we invited people from, basically the ones I just mentioned, the tripartite groups, but also some researchers. So we had about 30, 40 people. First, we presented research. We went through, what we know by now, the results of the AMOSH project, and then we had a concept mapping exercise with these people. And so they had been presented with suggested policy and action that could reduce risks and improve the impact of algorithmic management on health and safety. So in this exercise, they were asked to rank them on a scale from not very desirable to very desirable, and also rank each of the 23 suggestions according to whether it was feasible or not. And then we threw all this into the computer, and out came a map with a go zone where we could see that a few of these suggestions had come up at the top. And then there was a group discussion, so that we put them in mixed groups, and we sat down and we took notes. And then now we have summarized all of this. We summarized the research a bit, tried to keep it as simple as possible, and also what came out of this concept mapping exercise. So this has been sent out to all these participants and others, and with a message saying, if you would like us to come and talk about this, just contact us. And we received 10 yeses just within the hour of sending it out. So there was a huge interest. So this I'm very happy about. Another thing that happened at this November meeting was that there was a guy from the Swedish Labor Inspection there who had just been appointed to lead some sort of augmentation of knowledge when it comes to digitalization among the labor inspectors and other staff in this agency. And he came up to us and said, would you be interested in helping us with this? And we said, sure. And then we had a meeting, and he said, well, we're going to start with the experts. The labor inspectors is like the next step. But right now we want to educate our labor inspectors in the effects of digitalizations on the workplace. So we agreed to produce film modules for them, like training modules, 5 to 10 minutes each, on these different topics. We had a discussion. We came with a suggestion, and we're in the process. I think the plan is that we're going to go to their film studio in April and make the films, and then it's going to be rolled out to their staff. So that's fun. Right. So I said that I already had a project when I applied for Algosh. It was called AMOSH, and I thought I'd just go through a bit of the results from that project, since it's, we've come further in with AMOSH data than we have in Algosh. So we have 3 studies. One is a qualitative comparative case study in 2 logistics companies. One of them is an e-commerce company, and the other one is a traditional company. We also had focus groups, interviews and separate interviews, and a document study where we looked at social partners and government action and strategy when it comes to algorithmic management and safety and health. And thirdly, we sent out a survey via online channels to warehouse and transport workers. So the first one, the comparative case study, this is just very, very short from the results. So we saw that there was, on both sides, workers reported a low sense of autonomy and task significance. But when it came to physical and psychological strain from algorithmic management, it was more pronounced in the e-commerce company. And then we also, and then we have a long discussion. I don't have time for that now, but why it was so. But we also identified organizational practices that appear to have positively influenced workers' experience in one of the companies. And one was to involve workers with the AM technology, like in informing them and having, have a say about it, etc. Second was to integrate considerations about algorithmic management in the health and safety management at the workplace. Third was the design of applications that allow certain working control, so that in some instances worker could actually choose, to have something, to use one part of the technology or not. And then fourth, how the managers actually used algorithmic management or the data that was collected. So in one of the companies, the workers didn't see their data on constantly. They could if they wanted, and the managers were only using it as a discussion point when they had qualitative assessment talks. So it wasn't like the quantitative evaluations that are constantly made in both companies. They were not. They were used very differently, and it had very different outcomes as well. This is the one on the study on trade unions, employees' organizations, and governments, how they act and their strategies when it comes to algorithmic management. So comparing it, we saw that there was a gradual increase in interest from the early 2020s among all three, but there was a much earlier and much more active trade union engagement. The government and the employers sort of followed after a while. And we also write about the economic pressure that drives organizations that adopt AM. This came up, in all documents and interviews, that there was acknowledgement that, okay, algorithmic management may not be great, but we have to do it because of the economic pressures. And there was also overall a big theme was the ineffective safety and health management, where lack of knowledge was a big issue, that the labor inspectors have no competence when it comes to this area, the trade unions neither, the manager as well. There's this black box where basically nobody know. They know that it's there, but they don't really know how to handle it because they know how it works. And when it came to regulatory failure, it was the knowledge deficits I talked about before. So how can we use the existing safety and health and safety legislation when we don't really know how it works, how this technology actually affects the work environment? And then there was another thing, which was that the European Union was developing two legislations. One was the AI Act, that I talked about before, and the other one was the Platform Directive, and both were decided before at the end of 2024, but it took forever. It took much longer than they had anticipated, which sort of put everything on hold, because the Swedish legislators much follow the EU regulation. So it was like nothing happened because everyone was sort of waiting for these EU regulations to to be finished so that they could start looking at how it would look in Sweden and in other countries. Right. So this is the survey study where we're about to submit the first manuscript. It's based on a cross-sectional survey. We had 970 responses from drivers and warehouse workers. We measured algorithmic management exposure with an 11-item scale, capturing things like task allocation, surveillance, etc. And we looked at health outcomes such as psychological distress, musculoskeletal pain, headaches, sleep disturbances, occupational accidents. And we looked for associations, adjusting for blah, blah, blah. And these are the findings of this one. There was we saw higher exposure, an association between higher exposure with increased risks of psychological distress, workplace injuries, headaches, and musculoskeletal pains. And the associations were particularly strong for drivers. And we are going to continue and use this data more. We want to also look at causal mechanisms, moderating factors, and mitigating strategies, so that this can inform policies that balance technological advancements with worker health protection. So now I'm going to stop because I want to give some time for potential questions. It's only 4 minutes left. Sorry about that.
It's okay. I think that was my fault for the technical problems at the start, Karen. Does anybody have any questions they would like to ask Karen before we wrap up for today? Yeah, Melinda, I see you.
Thanks, Karen. That was a really interesting presentation. I have 2 questions, but I'll wait to see if we have time for 2. My first question is, you discussed how companies are feeling economic pressure to adopt AM, and I was wondering if this is overall pressure to increase productivity or because they fear being left behind competitors.
Yeah, well, I don't know if it's been what the situation was in Australia, but in Sweden during the pandemic, like there was e-commerce before the pandemic. During the pandemic, it exploded. So, which means that today we have many transport, like last mile companies, the ones that deliver that do the last bit on delivering the stuff that you have bought from somewhere. And because there's so many companies, then the competition is razor sharp. So like before, you would order something and you could expect it in 4 days and you would have to stay at home and wait for it. Now you can get it within hours and it costs nothing. So it's, yeah. And also, I mean, there's been an explosion because of the explosion of e-commerce, there's also been an explosion of these large modern warehouses where they have to use algorithmic management to keep up with the speed and the cutthroat competition. And the biggest companies, of course, they have fully automated their warehouses, but the slightly smaller, they still use people, humans.
Thank you.
Thanks.
Are there other questions? Otherwise, before Melinda asks her second, I might just build on that one. Karen, can you tell us, given from what you've seen in the warehousing, how algorithmic management kind of aligns or the role of robots or cobots in warehousing in Sweden and their relationship to algorithmic management?
In the warehouses where we visited, there were cobots, and no, they were not cobots. They were robots, actually, sealed off, large robots, traditional robots. but I don't think that it's not like in the US where you have like the Amazon warehouse. It's not there really. It's more automation.
Yeah.
That yeah.
More the digitalization that's driving it than the robotics themselves.
I haven't seen anything about cobots actually in the warehouses.
Okay, thank you. I do think we're at time. So if there are any other burning questions, if you'd like to just pop them into the chat, we'll take those away, and then perhaps Karen can formulate a response to you at a later stage, if that's okay. Jonathan or Maren, is there anything else you would like to add before we wrap up for the day?
No, just my thanks. Thanks, Karen, for a great presentation.
Thank you for inviting me.